SLPAs are very well-trained, licensed personnel in speech-language pathology therapy, treatment, and are extremely professional, extremely knowledgeable, and can provide amazing support to the speech-language pathologists.
So a speech-language pathologist diagnoses, assess, they write reports. A speech-language pathologist assistant, what they do is they take the report, they look at the treatment plan, and then from there, they deliver the treatment under a speech-language pathologist.
I see the benefit of working with speech-language pathology assistants as one where they're able to implement some of those basic therapy strategies. When you have a speech-language pathology assistant or a SLPA working for you, I think, or working with you, I think that you end up with a bigger bandwidth, greater opportunities to really serve the population.
For myself, in private practice, having as an assistant, it allowed me to grow. I was able to evaluate and treat and then work closely with the assistant and have them pick up and take over some of the training and do the therapy, where I could go back and then work on more of the business aspect. For my setting in particular, I look for somebody who's very outgoing, who is assertive, and who has a strong knowledge in their field and is not going to shy away from that challenge. You get that difficult child, and I want them to jump in and say, I got this. But then I want the person who's going to come back to me and say, I need help, because that's my job as their supervisor, to go back in there and say, what are we doing here? How can we fix this? What do you need help with?
It's a helping field. So when you come into a clinic, you might have to start being able to organize a master list, create an Excel sheet, do scheduling, or you might be able to start working in therapy. But you should always come in being a flexible candidate to get the most out of the experience. You might be doing in-home, you might be doing schools, you might be doing clinics, but you really have to be flexible.
There's two ways to become a SLPA. There is either an associate level degree that can be attained at a junior college, or one can also get a bachelor's degree in communication disorders. And most of the people who get it that way need to take an additional fieldwork course, because they do need to have 100 hours of clinical experience as part of their training. And then they become licensed by the state of California if they fulfill the requirements.
The coursework, and also being in the SLPA program, we're taught different therapy techniques. We're taught how to apply for our license. We're taught how to present ourselves professionally within the field. So I feel like I'm quite prepared to go on into the working field.
What I like about being a SLPA is that it was a lot more than what I had originally expected in regards to what my scope within the field would be. And I didn't realize how much therapy and, one-on-one contact I would have with children and adults and the populations we serve. It's a lot of fun, and I feel good about what I'm doing.
And I think that initially when SLPAs came on the scene, they're a relatively new profession, there was a fear that they would take over the jobs of speech pathologists. But the reality is that they can be our best support, and I see in the future that they would be primarily responsible for providing a lot of treatment, especially in schools, and a lot in private practice as well, probably a little less in the hospital environment. But then the speech-language pathologists, who are the experts, would be the ones who are making the decisions, participating in IEPs, doing comprehensive evaluations, speaking to parents about the goals and what the clients need. And it's a team. I see them as a really cohesive team of speech pathologists working very closely with SLPAs.
I think they get electrified just as much as I do, and that ability to give that child a voice. There's days where we all look at each other and just go, wow, look what I did. And then it's like, look what we did. And it's a great feeling.